Hello and welcome to India Top Doctor. Today we will talk about lymphedema disease, how it's caused and what are all the precautions one should take. And for this, today we will be having a little conversation with our guest, Dr. Anshuman Manasvi. He is a plastic and lymphedema surgeon at Nanavati Hospital in Mumbai. So let's welcome him. Hello, sir.
Hi, I'm Dr. Anshuman.
Yes, sir. How are you, sir?
I'm good. I'm good. How are you? What's your name?
So my name is Taisha. I'm fine.
Talishi.
Yes, sir.
Okay, nice.
So shall we
So,
start?
yes. Yeah, we can start. Absolutely.
Okay, so as you know, we will be talking about lymphedema. But before we move ahead, can you tell us something about yourself?
Okay. My name is Dr. Anshuman Manasvi, and I'm based in Bombay. And I have more than 25 years of plastic surgical experience. I have my own center called La Transformation Plastic Surgery Center, and we're starting a new setup within its premise called lymphedema and vascular center. And I'm also attached to Nanavati Hospital and Bombay Hospital, which are one of the big hospitals of Mumbai, and other hospitals like Criticare Hospital.
That is quite an achievement, sir.
Thank
So
you.
can you tell our audience what is lymphedema and how can you tell one, how one can tell if they have it?
Okay, so lymphedema is a scientific word, but let me tell you, all of us, majority of us may have seen patients with big limbs, hathi pair, yeah, or big hands, hathi hath. These are very common, especially in the eastern and southern part of our country. But all over the country, you may see these patients, and they walk with just like elephant foot. So, not a very good scene, actually, because they are in a lot of trouble while they are walking, and sometimes there's a lot of infection. So, in layman's language, it is called elephant foot, and in scientific word, it is called lymphedema because it happens due to accumulation of a special fluid called lymph, and it can happen in the leg or it can happen in the arms. To diagnose clinical established lymphedema can be diagnosed just by clinically seeing, although there are various tests and diagnostic tests which are there, which would actually pinpoint whether it is lymphedema and nothing else, and what is the place where the fluid is getting obstructed. There are various tests which are required, like lymphoscintigraphy or MRI, or a newer test called ICG lymphography, which are done. But most important thing is the clinical index of suspicion, that we must investigate patients who are having heavy foot or heavy hands, especially in patients who live in these areas which I told, which are endemic, and patients who have had surgeries for cancer like breast cancer or genitourinary cancers.
Okay, so let's talk about where does the story begins? How it is caused.
So there are two important reasons why it is caused. The single most important reason is what we called as Phalariasis. Phalariasis is a disease caused by mosquito bite. There are mosquitoes called Butyraria bancrofti and Brugia malai. And when they bite, they transferred a filarial worm, a nematode, a filarial worm into the bloodstream, through which it goes and lodges in the lymphatic system. The lymphatic system is a parallel system which runs as the arteries and the veins, and it carries important wastes as well as important proteins and antibacteria and antibodies which are not carried by the veins. So they are very important structure, and they finally go and meet and drain into the vein through a separate system. So these parasites, they get and get lodged in the veins, in the lymphatics, and they obstruct the lymphatics. So that is, and so that the lymphatic is not able to flow and the swelling occurs. The second important cause is the surgeries for cancers. In surgeries for cancers, there are certain glands which are removed, which are there either in the axilla or in the groin. And these glands are where the lymphatics drain, and from there, purified or filtered lymphatics, they go further. When these stations called lymph nodes are taken off, the fluid is not able to go further and gets accumulated. And the third one is a congenital one, where it is there since birth. Sometimes it manifests later, even after 20 years or 30 years. So difficult to pinpoint whether it is congenital since birth, but that is the third variety.
All right. So you talked about how when people go through any cancer treatment or cancer surgeries, they are likely to catch, lymph. But there has been an assumption going on at the same thing that during breast cancer treatment, people are most likely to get lymphs. Is it true?
Yes, although the incidence has come down, but breast cancer, cervical cancer, ovarian cancer, okay, uh, and other malignancies also where the lymph nodes are taken off can cause lymphedema. Breast cancer treatment causes lymphedema of the upper limb, and these cancers with a genitourinary cause the lymphedema of the lower limb. So let us not ignore that as well, because cervical cancer is one of the most common cancer in our country, commoner than breast cancer. But breast cancer patients also have this. But with newer therapies coming in, not in all cases, all the lymph nodes are removed. So if some lymph nodes are not removed, they remain and they are able to drain. So it actually depends on the stage and various other factors based on which the doctors decide how many lymph nodes to remove, whether they should remove or not. But if the lymph nodes are removed, then the patient is at risk of development of lymphedema.
Okay, so we have talked enough about the causes and about the disease. Now let's talk about something about treatment. So there is a question of mine. Will exercise help with fighting lymphedema?
Exercise, yes, it helps, because what happens is that with the exercise, the lymphatics are pumped. And once they are pumped, they can move forward. So even if there is a small drainage which is happening, suppose in a patient where many of the lymph nodes are removed, and there are a few which are there, which are normally very less to transport that much lymphatic. But with exercise, the fluid will be pumped, so lymphedema can become a little better. So that way, as an adjunct, exercise definitely helps. but not isolated. There are other things in non-surgical management, like wearing the compression bandage, and there is a special type of massage called manual lymphatic drainage. So these compression bandages and manual lymphatic drainage will propel the fluid further up. And they are the mainstay of treatment apart from the exercise in the non-surgical management. Because till a few years back, the surgeries were not involved, not evolved so much. And these were the mainstay. Even today, they remain one of the mainstay of treatment because by surgery also we can control it, we can decrease the extent of lymphedema, but final maintenance will come through these when these are followed. To help in the post-operative period also these are important.
It was sure quite amazing. So can you suggest any, exercise routines for our audience or any lifestyle choices they should improve in their life?
Exercise, especially muscular activities of the leg and the arms. Okay, so not just activities of the trunk. It is mostly of the limbs when we do. They are likely to increase the pump. So, like brisk walking, little bit of jogging, and then we have this yoga postures in which we do this Vajrasana is there, and there are other activities in which your limb is folded and then pressed upon. So this pumps the muscles. So these are basically we have to put some pressure on the muscles and make the joint also mobile apart from pumping the muscles. Lifestyle changes, very important is limb elevation because these patients, once especially in the leg, if you keep the leg down and stand, the fluid will remain down, stasis of the fluid. Similarly, in the hand, if the hand is hanging down, the fluid will accumulate over here. So, in between, during the day, we should try and keep the hands elevated or the legs elevated, lie down for some time. If you're working, put your leg on the chair for some time so that it is elevated. And in the night, definitely put pillows underneath your feet or hand so to make sure that they are elevated. These are the most important lifestyle changes, apart from wearing regularly the compression bandage and the massage, annual lymphatic drainage.
Okay, and can you tell our audience about the possible side effects of lymphedema?
One more thing I want to tell in the lifestyle, very important is to prevent the infection. So my
Please.
suggestion to my patients are have at least 7 pairs of socks, white in color. Every day you change one so that you know that your socks are not dirty. If they are dirty, you will be able to find. Inspect your feet every day. Look in the web spaces and have a mirror so that any scratch, any wound, you should be able to find out and see the every episode of an infection can give rise to increase in the swelling and also hardness, which is very, very difficult to treat.
So now, please tell our audience about the possible side effects.
Side effects, the most important side effect of lymphedema is that limb becomes very heavy, very difficult to carry. Second one is repeated episodes of infection will give rise to more swelling. One needs to prevent that. And the third one for the lymphedema is that the wounds which form at the later stage. So in case the infection is neglected, it forms a wound, zakham ho jata hai, and then that heals very poorly. So one condition keeps on deteriorating unless and until some active measures are taken, including some surgeries.
Okay, it was great talking to you, sir. I won't take much of your time now. Just one last question. Any message you would like to share with our audience regarding lymphedema?
Uh, Very important message, which probably you have missed in your question, and that is the surgeries.
Right, sir.
Now, in last 5 years, tremendous amount of work has been done on lymphedema surgeries, and what was thought as incurable can be cured. We have had patients whom we have got 60-70% reduction of the swelling by surgery, super microsurgery called lymphovenous shunts. And these surgeries are really amazing. And you must spread the message, people should spread the message that lymphedema can be claimed to be cured today, which was not the case 5 to 6 years back. And that is a very, very revolutionary uh, change which has happened in the
Yes,
world
absolutely.
today. And we in India, in our center, are doing treatment at par with international standards, or maybe better than them.
That was actually
And
it's actually my fault
one
that I
more
did
thing,
not.
last thing in the prevention part, those who live in the endemic area, they must use mosquito nets, which is out of fashion now.
Right.
But if they use mosquito nets, they will be safe because malarial mosquitoes usually bite in the night, and they should wear full sleeves shirts and trousers. That is how they will be helped. Mosquito
Thank you
net
so
is
much.
another message which I want to give. Thank you so
It
much.
was really great. Thank you so much, sir. It was really an enlightening
Thank
session
you
we
so
had.
much.
Thank you, sir.
Thank you so much.
And if you guys want to book an appointment of Dr. Anshuman, you can do the same by visiting India Top Doctor.